Welcome, everybody, to Better with Age podcast number 4. Today, I have the great privilege to be with my friend and colleague, Ann Kaminski. If I need PT help, this is the person that I go to. So, Ann has been in the field for over 23 years. She is amazing and eclectic in her approach, and today we're going to talk all about stability, why you should care, what it is, and maybe how you could get a little bit more of it. So, first of all, Ann, thank you for joining me as we talked about this is our last kid-free Monday before school is out, and the home will be alive with lots of kinetic energy.
Yes, and my husband's a teacher too, so this is my last Monday to myself.
Well, thank you for sharing it with us. So maybe begin by telling us a little bit about yourself and your clinic.
So I own my own private practice. It's a cash-based practice based here in St. Paul. And I have owned that practice for about 1.5 years now. And I also practice 1 day a week at the clinic Vibrant, where I've practiced for over a decade. And I run their mentorship program there on Wednesdays. So I mentor small groups of therapists at Vibrant for 8 weeks at a time through that program that I've created and run. So that's been kind of a long-term dream of mine to make that happen. So I'm got a little bit of a couple different things going on. And then the other thing that I do is I teach continuing education courses to physical therapists all over the country through the Institute of Physical Art. So I have a few different balls in the air that I juggle.
That's excellent. Well, tell us a little bit more about maybe your background within the world of physical therapy. So I was having 2 conversations with separate people today, and their idea of what a PT does is hand you a sheet of exercises. You're in a gym, maybe you're pulling on a band and that sort of thing. And what you and I is very different than that. So give a little background about where you got your schooling and maybe just some of the philosophy that you employ when you're working with people.
Yeah, so when I started working, especially in the outpatient world, over 20 years ago, I quickly realized that there was a lot of people that I just felt weren't getting better to the level that I thought they could be. And that was frustrating for me as a therapist who loves to help people. And I, deeply cared about these people, and I wanted to see them make progress to achieve the goals that I thought that they could. And I quickly realized exercise alone just wasn't getting them there. So I started taking continuing education courses, and I stumbled upon the Institute of Physical Art, which is a manual therapy-based institute that is very eclectic, but it's very hands-on. And that's very different than a lot of physical therapists.
Mm-hmm.
I believe that in order to move well, it's really helpful to have someone use their hands to help mobilize the soft tissues, the fascia, the nerves, the joints, because when your body moves well, your muscles activate better.
Mm-hmm.
And so sometimes, I see this all the time, and I'm sure you do too, people who try to exercise, but they end up just feeling worse
Mm-hmm.
and they hurt themselves. And I think that hands-on component is the key to get them able to fire the right muscles and actually move well without creating inflammation and pain. And so I think that's an integral part of my practice, is that hands-on component. And that is a means to the end also. I'm not a therapist who believes that you just lay down and let me cure you with my hands, but it's really, my hands are a tool to get you up and moving so we can create healthy movement and get you stronger and more stable.
Very well said. And what a nice segue into our topic of discussion today, which is stability. And maybe it would be helpful to just proffer a definition, how would you describe stability in its sort of global sense and why it's so important for each of us to have?
Well, I think it's so important because it prevents injury. It's extremely protective. When we're stable, that our spine is protected, our muscles are protected. So it prevents injury, it creates safety. And I think that's super important as we get older. Because one of the big things that I see is people have injuries and they stop moving. And I just or they hurt and they think that that's it's time to stop doing that XYZ activity because they're just too old for that. And I hate that mentality.
Mm-hmm.
I want to keep people moving. I was just working with the Ironman athlete this morning and I was like, he's like, I'm only in the top 10% now, but he's only in his 40s. I'm like, well, all we got to do is maintain you and then you're going to get on that podium by the time you get to 70. And he was all for that. So it's important because I think it helps prevent injury. I also think it's important because my definition of stability is it's a movement where your core fires first and your core fires automatically. So with all of our functional movements in life, and they've done research to show this, they've had people stand and raise their arm over their head. And they've done studies to show that even just thinking about moving, not actually moving yet, your core, the deep multifidus muscles in your spine, will fire in anticipation of that movement of your arm. So that's natural. That's what we want for our patients. And that's what we want, hopefully, for my own body too, and yours, is that core should fire automatically, even in anticipation of our movements. And so that's what I think stability is. And that's what I want to try to help facilitate people to have to move better and to be safer.
Sure. So when you look at it, do you have a particular framework that you use to, I guess, diagnose or assess? And do you look at static stability versus dynamic or a combination of the
Yeah,
two?
I think it's a combination of the two. The first thing I look at when I meet somebody is their posture. And I think posture is so very important to stability because I describe our core system, if you look at our midsection and our trunk, our body, as a soda can. So if just like a soda can, when the soda can is sealed and is carbonated and pressurized, it's really strong. You can stand on top of it and it's pretty sturdy. And our midsection is a pressure system as well. And what we want is that pressure system to have a nice seal. So when your muscles contract, it's carbonated. We have that stability in our trunk. What happens in the soda can, if you pop the top open or you poke a hole in the side, all of a sudden it loses that strength and it's
Sure.
very easy to crush.
Mm-hmm.
If you stand on it, you can easily crush that soda can or pinch it and squeeze it and it'll crumple. So our midsection is like that soda can as well. And that's what creates that strength and stability in our core. The parts of the soda can, so if you want to think about the top of your soda can is the diaphragm and the bottom of the soda can is the pelvic floor. So it's really important. When I look at posture, I use that idea of your diaphragm and your pelvic floor really need to be lined up on top of each other. If we have somebody who's really lifting their sternum up and tipping their rib cage backwards because they think they have to do that in order to have really good posture, think of like a gymnast or a military posture. What happens is your diaphragm is tilted backwards and it's no longer sitting nice on top of your pelvic floor. So you lose that stability. It's like somebody popped the top off. So the first thing I want to look at and what we all should look at in our own bodies as we're trying to build strength and stability is can we line our diaphragm and our pelvic floor up on top of each other during our activities, whether that be just sitting or, lifting weights or maybe pushing your Costco cart or lawnmower. We want to have that alignment, that posture is really important. When we get that diaphragm lined up over our pelvic floor, that pressure system is equalized and it creates that stability for our core to automatically fire. And that's really what I'm looking for initially, is that alignment and that posture.
Sure.
It's very easy also for patients who, all of us as well, to sit and slump, right? And so we're kind of, rounding our spine and having that rounded posture. And now our diaphragm is, tilted in, and also our diaphragm is not expanding well. It's not lining up over our pelvic floor. And again, we lose that stability. Another analogy I think of is, if you can imagine your diaphragm, it's this 360-degree around dome-shaped muscle. If you imagine your diaphragm as a big flashlight or one of those searchlights, and it's shining straight down, it should shine straight down into your pelvic floor and straight down into the arches of your feet if you're standing. So if you're really leaning backwards and with that military posture, or that, think of a gymnast, that diaphragm is going to be shining in front of your toes, right? So you're losing that alignment. And if you're sitting in a slumped position, or you're rounded through your shoulders and forward head, that diaphragm is going to be shining backwards almost through your heels. And both of those things are going to make your core weaker. So just by lining your diaphragm up on top of your pelvic floor, AKA have good posture, you're going to have better stability, even without doing any exercises. So that's sort of like step one that I look at with people, is I want to see, what does their natural posture look like? And can we kind of facilitate with some cues? How do you get into that better alignment? And sometimes cueing isn't enough, because sometimes the muscles are so tight, and I find joints that are restricted and fascia that's tight. Even some abdominal visceral restrictions can cause problems, differences in rotations in the pelvis. So there's all sorts of mechanical problems in the system that can create problems in that alignment and that posture. And that's, where the hands-on help can be really helpful too, to help kind of restore that alignment.
Yeah. So if people are maybe sitting in their car, or maybe even standing, going for a walk, right now they could maybe practice this idea of shining that light down into their pelvic floor and almost playing with that.
Yeah.
Do they feel like that is their natural posture? Does it feel different or abnormal? That might be something good that people could play
And you
with and
can kind
explore.
of feel, if you tip your rib cage backwards, how that would be too far. And if you let it collapse and slump a little, you can feel how that would be too far the back, shining the light behind your heels. So kind of finding that midpoint where it's not shining forwards, not shining behind your heels, but right down through your arches, and right down, if you're sitting, through your pelvic floor. What I find too is, a lot of times, if you really get that diaphragm in alignment, the pelvic floor will come with it. So I tend to cue mostly with posture is the diaphragm, the rib cage, to get the diaphragm in that position. Because oftentimes, if you have an anterior tilt in your pelvis, probably there's some diaphragm issues as well. And oftentimes, if you just fix the diaphragm, the pelvic floor will come into a better alignment automatically. We don't even have to cue that. So I really focus, when I'm having people improve their posture, for stability reasons. There's research, showing sometimes people argue with me about posture, and I think it's so important. Sometimes people argue with me because there is some research that says, like, posture is not correlated to pain.
Right.
And I would, say, great, I'm not trying to change your pain only. I'm trying to make you stable and more strong, so your body is protected going forward. Because pain itself is much more complicated. It has to do with, there's inflammatory things going on. We have your brain that we have things going on, especially with chronic pain. So I'm just talking about, truly, can we make you more stable and strong in this position?
Yeah, we could talk probably for a long, long time about
That might be a whole
pain
nother
and all the
podcast.
areas that get wrapped up into that. So,
Yeah.
yes, I think that's very well said. So, you've talked about the diaphragm a couple times. How does breathing play a role in our stability? And maybe if most people have heard of their diaphragm, but if a person
Yeah.
hasn't heard of their diaphragm and they're wondering what the heck you're talking about, how
Yeah.
would you describe that to them?
Yeah. So I grew up playing the trumpet, and I wish so much that somebody would have just showed me a picture of what the diaphragm looked like.
Mhm.
Um, so if you're on the computer at home, you can Google on YouTube and just look up a 3D diaphragm video. And you'll see the diaphragm is a dome-shaped muscle. And I always thought of diaphragm breathing as your belly rises and falls. But really, that diaphragm, it drops down as you inhale. So that diaphragm drops towards your pelvic floor on the inhalation, creating a negative pressure system to like suck the air into your lungs. Um, and then as you exhale, it floats back up. So it's really, and not your belly rises, but your sides go out sideways and your back even goes backwards. It's a 360-degree expansion on the inhale.
Mhm.
And the diaphragm really does need to drop down. A lot of people get stuck in a reverse breathing pattern where it's like everything goes up when they breathe in. And then you don't get that nice compression into your pelvic floor, which keeps your pelvic floor healthy, which helps that whole stability in your pressure system. So it's really as you inhale, and you can imagine this as you're sitting here, as you inhale, you want the diaphragm to drop down towards your pelvic floor, towards your feet. And as you exhale, it floats back up. So that in itself is probably step one is,
Mm.
step two, maybe. We start with posture, make sure they understand how to align up the diaphragm. And then step two is how to breathe. And I think that's extremely important in stability.
If a person knows that they are a vertical breather, they know in their heart of hearts, maybe they see it in a mirror or
Yeah.
people have told them or they just feel it, and they don't have a pathway out of that pattern, what kind of cues might you be able to offer them to start to change that so they can use their
Yeah.
diaphragm more efficiently?
Well, I think one thing is, I think the diaphragm is a smart muscle. Like there's so much, everything gets in the way. So one of the cues that I tell people is just relax. It's the stress in our lives that really get in the problem. So as we relax our belly, we don't hold it in. So a
Mm-hmm.
lot of times there's a clenching pattern in your stomach. You're holding your belly in because maybe you're not comfortable with the size of it, or it feels uncomfortable in your back to relax.
Sure.
So you're guarded a lot, or you feel like you've been taught that you have to do that to have good posture. So I would say relax is the biggest cue. Relax your belly, let your Buddha belly come out, I tell people. Don't collapse your posture. Still, you want to maintain that good alignment. Um, but mostly it's about letting go rather than forcing the diaphragm to move. If we relax the belly, if we relax the neck and the jaw and the shoulders, if we get that tongue on the roof of the mouth and just simmer down a little bit, the diaphragm is going to come to life.
Sure.
So that's the big cue is trying to get out of all the holding patterns that we're stuck in, and all the clenching and the tension and the holding and the squeezing. So as we start to relax, the diaphragm starts to expand.
Sure.
And then the second thing is I just like to educate people on what it looks like. So just like Olympic athletes, they do some imagery to, make their perfect ice skating routine before they go out on the ice. You know, 20% of our motor neurons or our neurons are mirror neurons. So just thinking about a muscle moving will help it move better.
Mm-hmm.
So I just really educate people on like how the diaphragm moves. Like, a lot of people don't understand that it drops down on the inhalation, and what that might look like. So that's the two things I would say. One is relax the holding patterns. And then two is understand how it's got to actually drop down on the inhalation.
So maybe fewer cat videos and put in just a few more diaphragmatic breathing videos. That might be
Yeah,
a
yeah.
helpful
I
thing to
tell
get
people
the
that's the
mirror
hardest thing I'm
neurons.
ever going to teach you. All the, crazy deadlifts and like whatever else we're going to do. The hardest thing that I'm going to ask you to do is to breathe. Guaranteed.
How do the rules change when somebody's core is activated? So let's talk about a deadlift. Maybe we have an athlete or a weekend warrior, just anybody that's working out in the gym and they're getting used to maybe doing squats or overhead presses or something where they're starting to load their body. Does breathing change in any fundamental way as far as the relaxation component?
Yeah, when you start getting into heavy lifting, it does change because that diaphragm creates some stability. So if you're going to be, lifting, we're talking heavy weights, there is a moment where you want to use your diaphragm to help brace a little bit. Um, but that's usually not where I start people.
Hmm.
Most people, it's really about learning to not um, bear down, right? Or Valsalva as they're lifting. So cueing them to make sure that they are breathing, because your pelvic floor can really get compressed if you're holding your breath and Valsalvaing as you're trying to.
Mm,
So the first thing I want people to do is just to really learn to breathe
sure.
and not bear down.
Well, let's talk a little bit about the pelvic floor. So you talked about the top of the pop can. Let's go down to the bottom of the pop can and talk about the role of the pelvic floor in overall stability.
Yeah. So just hugely important, um, and very problematic. I mean, the amount of pelvic floor dysfunctions is very large. Um, not only in females, but men as well.
Hmm.
Most of the pelvic floor issues that I see, a lot of it stems from the pelvic floor being too tight.
Mm-hmm.
And so when those muscles are really tight, they can't contract well. And those pelvic floor muscles are what help keep you from having any urinary incontinence, which is extremely rare, not only for after having babies, but as you get older. And those tight muscles become very weak. And the muscle contraction is what really helps you stop and start um, the flow of urine. And so without that strength and stability in that system, you can see how that could be a huge quality of life issue. And it
Yeah.
is for a lot of people. Um, and so balancing that pressure system, again, they did some studies on pelvic floor strength, and they put two groups of people, and one of them they taught how to do the traditional Kegels, where you're trying to draw the pelvic floor, tightening the pelvic floor muscles up and in, almost like you're trying not to pee
Hmm.
or stop your urine. And the second group of people, they did only breathing. They just taught them diaphragm breathing exercises and had them go do that for 5 minutes at home as their home exercise program. And the group that did the diaphragm breathing exercises actually gained more pelvic floor strength than the group
Mm-hmm.
that did the Kegels. So I just think breathing is so important, even for your pelvic floor, um, to maintain that strength and healthiness, because it really is a co-contraction. You're not activating your Kegel muscles, your pelvic floor muscles by themselves. It's that pressure system. So you have to have that good diaphragm motion, co-contracting with the pelvic floor, and in the front is your stomach muscles. The front of the soda can is that deep transverse abdominal muscle,
Hmm.
and it wraps around to the thoracolumbar fascia into that deep multifidi muscles in the back. So they really all are part of that system. And so I think the idea that we can exercise one part is false. I
Mm.
think we really do need to work the whole thing. Um, and so, yeah, even for my pelvic floor patients, the first thing we do is we work on breathing.
Hmm. Have you found a number of patients that have come to you? Maybe they have some symptoms of pelvic floor dysfunction, could be incontinence or painful urination or things of that sort, and they've been doing Kegels for years and years because they saw it on Google or somebody told them
Yeah.
about it at the yoga studio or something like that? Do you find that you have to shift their paradigm a little bit to
Yeah,
more of a letting go to get stronger
that's,
versus feeling like they always
yeah.
need to be
I,
tightening?
I I have a patient right now that has, I mean, decades. I mean, her kids are in their 20s, right? And then she started first having problems after her kids were born, her boys, and she's had decades of bladder problems and had
Mm,
surgeries and slings and things like that that never really did the trick. And the thing that's really helped her the most is we've released, she had a lot of stomach, kind of almost like a hiatal hernia where your stomach gets stuck in your diaphragm.
mhm.
And so your diaphragm can't expand well. So you really can't get that nice down and up movement from your diaphragm because your stomach is kind of jammed up in there. So for her, that's where she got the biggest change, and she's um, had the best results in decades,
Mm,
because
mhm.
even better than the surgeries that she's done, because she can actually get that. Plus she's done other things too,
Sure.
right? We've balanced her pelvis and core strength, but it's really zooming out and looking at the big system. And sometimes it's not just all about Kegels.
Sure. Well, I think that's very well said. Let's shift gears just a little bit and talk about maybe some general tests or screens that a person might be able to do for different regions of their body. And maybe we're talking about pelvis, so let's talk about pelvis. Do you have any good screens or tests that a person could do at home to help give them a clue to whether they are properly stabilizing their pelvis and able
Yeah.
to shift and support the load?
Yeah, one of my favorite tests that we all can do at home just to see how we're doing. One of the things that I find a lot is, and I'm sure you do too, is, people are doing exercises, all these core exercises, and it sounds great. You ask them what they do, and like, oh, yeah, I do, crunches, and I do these, dead bug exercises, and they list all the things that they do, and I'm saying, okay, that sounds good. You're that XYZ, great. Let's just test your strength, right? And they're not strong. So I see that a lot of people doing the exercises, but not necessarily getting the results they want, because maybe they're not engaging the muscle properly.
Mm,
And so how do you know if you're engaging those deep abdominal muscles properly with your pelvic floor and your diaphragm is lined on top and all those things? So I'll have people just lay on a foam roller. So their head's at the top of the foam roller and their tailbone is on the bottom of the foam roller. So they're on their back on the floor. And you can just put your like fingertips, a couple fingertips on the ground for balance. And you can contract your deep abdominal muscles and just try to lift one leg off the ground and see if you can balance. And if you're doing well, should be able to do that without your hands even touching the ground.
mm,
And then here's the other thing is make sure you test both sides. Put that foot back down slowly. Again, engage that core and see if you can lift your opposite leg just a couple inches off the ground. It doesn't have to be high. And a lot of times there's a big difference side to side. So it's a nice way to see some of the subtle weaknesses, because sometimes one side is great and you go to lift the other leg and you really tip sideways, right?
sure,
You really
sure.
twist. And sometimes it's subtle and you don't realize it with any of the other exercises that you're doing. So it's a nice little test that you'll kind of can see, how is my stability?
Sure. If somebody's doesn't know how to activate their core, how would you cue them how to do that?
Yeah, well, first with breath, as I said before. So the first thing is like getting your breath, making sure your alignment is good. So whatever exercise we're doing, if we're doing something in sitting or laying down, it's a little easier to find that good alignment. Or if you're on hands and knees, or standing, first thing is getting that diaphragm over the pelvic floor. Second thing is breathing. So I tell people take a deep breath in, and then as you exhale, blow out as much air as you can and keep blowing out that air until you feel like you're engaging abdominal muscles to kind of help you.
Mm, mm-hmm.
At the end of that exhale, you'll feel that engagement. And you want to hold that abdominal engagement as you learn to breathe again. It's not a big breath anymore. It's a smaller, shallow breath. And then a lot of times I'll cue the pelvic floor at that point too. Say like, can you think about drawing that pelvic floor up like you're trying not to pee, and cue that Kegel contraction as part of that core too. And so once you have that isometrically, then we can start to create some movement, like lift your leg off the ground
Sure.
if you're laying on that foam roller.
Yeah. What if somebody doesn't have a foam roller? Is there any good substitute? Could they just do it lying on their back on a flat surface, maybe on the floor? Would that still give them any clues, or is it
Yeah,
is it
it's a
too
little more
too?
subtle. You could put your
Mm,
hands on the pelvic bones. It's called your ASAS. And then you can just see as you lift one leg up off the ground, if your pelvis twists or if your back arches. You'll be able to feel that if your hands are holding onto your pelvis. There should be no motion. Our core
hmm
should be able to hold our trunk stable, so there's no movement as our leg lifts. That's what we want to see. It's more obvious if you're laying on the foam roller, or maybe even a rolled up yoga mat would work, because you're going to tip off of that
Sure,
balanced yoga mat. But even if you're laying flat on the ground, you could be able to feel that subtle shift or your back kind of arching a little bit, as you lift your leg off the ground.
sure. And you can see how that test really becomes its own exercise pretty
Yeah,
quickly, just
exactly.
working through
Yeah.
that. Yeah,
Yeah.
that's excellent. How about shifting gears, the shoulder? If somebody's wondering about if they have good stability in their shoulder, shoulder blades, all the muscles that help to keep reach and throw and all of the different activities that we do you have any good tests for that area?
Yeah, I again, I think about as you're sitting, so if you could just, sit and grab onto like a gallon of milk or something, um, you're gonna notice right away, what I want to see is I want to see your shoulder blade as part of the stability of your arm, right, of your shoulder, even your whole upper body. And really what your shoulder blade should be able to do is connect into your core. And a lot of times people don't think of that as a bigger picture. They think like, oh, it's a glenohumeral joint. It's, something, right up in here. But really what we want is we want our shoulder blade or scapula to engage into our core. So that weight transfer, as we hold that gallon of milk, transfers from our arm into our shoulder blade and into our core. If it doesn't, it's going to be up here in your neck, most likely, or maybe in your middle back.
Hmm,
Um, so if you just grab onto like a 10-pound weight or a heavy um, gallon of milk or something like that, and first just sit, and you can just feel how your posture creates stability. So if you kind of slump a little bit and pick up that weight and feel how heavy it is, and feel what muscles am I using to hold this weight, right? And you can even reach out a little bit in front of you to make it harder. And then put that diaphragm, shine your diaphragm right over your pelvic floor and compare. Now pick up that gallon of milk or that 10-pound weight and hold it, maybe reach out and just feel how your muscle activation is different.
hmm, hmm,
And what you should feel is that there should be no tension and strain up into your neck and shoulder, your up and trap, but your shoulder blade should be able to stay down out of your ear. It shouldn't slide up. And you should feel that weight transfer into your midsection.
sure. Yeah, that's excellent. How about feet? Do you have any screens or uh, I guess tests or anything that you can do to see if a person is loading or creating good stability through that person's foot that ultimately will move on up through the knee and hip and low back and all of that?
Yeah. So when I see somebody in person, what I do is I put my hands right on top of their shoulders, and I do what we call in the Institute of Physical Art, where I learned this test, it's just a vertical compression. So if I put my hands on their shoulders and I slowly put weight through their shoulders, what I want to feel is that weight of the world, the gravity, is like coming down through your shoulders and straight down into your arches. You really should stand. That's why we have arches. They provide shock absorption. You should really be able to load straight down into the posterior arch as you're standing. So you can kind of rock forward onto your balls of your feet, rock back onto your heels, and see if you can find that place on your arch that's right in the middle. That's where you want to feel like you're loading through. And in order to get there, you have to have your diaphragm over your pelvic floor as well. So to get that load to transfer, whether you're, carrying something heavy or just standing for 3 hours, to get that load to transfer through your midsection and not get stuck in that spot in your back or stuck in the hips. You want to have that good alignment and that transfer that load straight down into your arches.
Sure. How much does the game change if somebody's wearing a high heel,
High
for
heels.
example, or some kind of shoe that may not be
Yeah,
designed for biomechanics, but for looks? How does that
yeah.
change the dynamic, not just in the feet, but throughout the whole system?
You just have to be that much more precise. I see like it definitely makes things harder. It kind of reminds me like the question of like, well, you can't always have perfect posture or perfect alignment. Like look at, sometimes the athletes, like if it's a crazy rock climber and you're like twisting to get a climb, like all of a sudden your diaphragm is no longer over your pelvic floor, right? You're way outside of that normal alignment. But if you are stable and strong and supple in that good alignment, you're going to have more flexibility to be able to break the rules, right? So I'm not such a purist that says like absolutely nobody can ever wear heels again, right? But if you can't stabilize in neutral and bare feet, you put heels on and you're going to really fall apart, right?
Hmm.
But if you could create the resiliency to be good and neutral alignment. And now when we take you into that crazy activity you want to do for your, go dancing in your heels for that wedding, great. Your body has enough resiliency to do it for that one night. Just don't do it every day.
Yeah, yeah. Yeah, that's good. That was good alliteration too. Stable, strong, and supple. I think that's maybe
Yeah.
the
Yeah,
tagline
and
of your
that's
practice.
too the course that I teach is called proprioceptive neuromuscular facilitation. So it's called PNF. And really what it's kind of a long history. PNF was founded back in the days of post polio,
Mm,
and it was really looking at how do we get people who have these really severe neurological disabilities moving again, which was kind of a foreign concept. It used to be back in the day that we would just support these people and give them comfort measures. And they started pushing and pulling on these people's arms and legs and making them exercise and move dynamically and try to re-engage their strength and their stability again. And so what they found is that our bodies really move in three-dimension diagonals, right? So we talk about stability, and so far we've really been talking about like straight planes, static stuff, but our core is really dynamic, and it should be supple, and you should be able to move in 3 dimensions through our scapula, through our pelvis, and through our whole trunk. And I think that's, when I see that athlete just sprinting in the Olympics, it's so beautiful to see how
mhm.
their trunk, if you watch them from the front, they get this like beautiful 3 dimensional, lengthening and shortening in these diagonal patterns. Or from the sides, their trunk lengthens and shortens, and you can just see they get this power from their midsection. So I get really geeked out when I watch that, and I see
Yeah,
people move
yeah.
really well.
I think that's awesome too. One of my favorite things to watch is Cirque du Soleil and
Oh
some
yeah,
of the I don't know if you call them athletes, but the performers, the dancers. I mean, their movement is
amazing.
just it's artistic. It's just such a thing
Yeah.
of beauty to
I
be able
do
to
think
watch.
dancers probably have the best stability
Mm,
ever, right? Because it's like this dynamic stability. They can lengthen. They have the mobility through their whole midsection to really lengthen in all ways, but yet still be super stable. So yeah, when I work with high level ballet dancers, it's just, yeah, it's beautiful.
Yeah,
I'm jealous.
that's awesome. Well, let's shift gears just a little bit more. And how has your notion of aging changed, both as you've gotten older as a person, but also gained more insights as a practitioner?
Hmm. I think one of my things that I think about is like age is never an excuse, right? There's always
Mhm.
a bigger reason. Like if somebody says like, "Oh, I'm just getting old," I'm like, "No, that's not the reason. There's something going on here." And I always want to understand why. So I'm always trying to dig out like, well, why can't you run? Or whatever it is that, you're blaming on just, well, that's age. I always think there's a reason. And then sometimes those reasons can be changed and influenced, and sometimes they're um, more genetic, but I tend to be the optimist always. And I think that prevention is key too. Um, if we can prevent those injuries and prevent people from getting sedentary, if you just keep people moving, it's so much easier than it is to kind of come back after not doing anything for years. Um, so I'm really, and that's the one thing I love about being in a cash-based private practice is I can now treat people in a preventative way, whereas I really couldn't do that as much with an insurance-based practice because insurance doesn't believe in covering that,
Mhm.
which I understand. There's just not enough money to go around, but I see so many people wanting to be preventative, and I really believe in that as well.
Yeah, I share that as well. Age is never an excuse. I think if there's a promo for this show episode, that's
Yeah.
going to be the one right there. That's very well said.
The
I
the other one thing I would say just personally that I've noticed as I'm in my, perimenopause years here now is about strength training is just so much more important. I didn't put enough importance on that because when you're younger, like you just are strong, I don't know, without thinking about it.
Mhm.
And what I've noticed is, boy, I have to actually work at my strength now.
Mhm.
Like it is no longer something that just is there for me if I don't do it. Um, so I would say that's the other thing that I've um, really increased my emphasis on is loaded strength training.
Mhm. I think we share a lot of similar
Yeah.
passions. That's for sure. So you talked about strength training. Do you have any other non-negotiables that are part of your wellness, your fitness, your health routine, things that you you're gonna get them in, come hell or high water, you're gonna make it happen because it's just such an important part to keeping your health vital.
Yeah, I mean, for me, it's exercise with friends. And I
Hmm.
think that like that for me is just I can't not do that. And it's part mental health for sure for me. That's just as much mental health. I know it's physical too. But I get more joy and more happiness like going out for a bike ride with some friends or meeting up with a friend for a run than I do doing it by myself.
Hmm.
And it helps me stay motivated in the long run because that's always, I'm a human being. Even if this is, something I preach for my profession, it's hard to kind of um, keep yourself accountable over the years. And life is super busy for me right now. So I feel like when I can exercise with friends, I get two birds in one stone. Like I get
Yes.
that social, I get that joy that I can have that social connection with people. I get exercise and we push each other, right? And so I get even more out of it sometimes than I would by myself. So I would say that's one thing I can't skip.
Yeah, I think that's tremendous. And I think it also speaks to the point that you anything is better than nothing. And you can start, and if you can have a person that you can share some walks with, or as you said, go for a bike ride, pickleball's
Oh
obviously
yeah.
the all the rage these days, and there's
I'm
just such a
I'm
nice
definitely in the
element
pickleball
to it.
rage too.
Do you have any other words of wisdom, I guess, just about anything with stability or with age or exercise that you think would be important for people to hear?
Yeah, I think that I would say be proactive. I think the biggest thing that I see is um, if you can deal with a problem when it's small, it's easier. So don't let things snowball into the place where, you haven't been able to walk for a year because of this problem.
Mm-hmm.
Um, there's so many different practitioners out there. If you're not getting success or help with one person, be proactive. Go find a different practitioner that's going to help you.
Mm-hmm.
Go find a different therapist. Go find a different doctor. Go find some alternative medicine practitioners. Keep looking for other people to help you. But don't give up. Because I think that if you can keep things moving and keep your body active and healthy before things snowball, that's my biggest piece of advice.
Awesome. So if people are interested in learning more about you or potentially working with you, Anne, how can they find you?
Let's see, I have a website and my business is called Lumina Physical Therapy. And so my website is luminaptwellness.com. So that's probably the easiest way is just to hop onto my website and you can find out more.
I think that's excellent. Well, I really appreciate your time today. It's a beautiful day out there, so we might go
No, I'm
out
gonna
and get
go
a
for
little
a
bit
bike
of
ride.
exercise before our kids get home. We'll have to see how that goes. But thanks again. And as you said, people can find you at your website if they have more questions. So um, have a wonderful rest of your day, and I'm
Awesome,
sure I'll see you
Galen.
soon because
It's fun chatting
jujitsu
with you.
keeps me
I could
coming
do
and being
this for like
proactive
5 more
about my
hours,
health for
so
sure. All right, thanks, Ann.
have a good one.
Bye. Well, thanks for listening to the Better with Age podcast, episode number 4 with Ann Kaminski. Hope you enjoyed our conversation about stability, and it's given you some ideas on how you might be able to improve your own, or at least assess it, and for that matter, just the overall importance. If you're interested in learning more about Ann and her practice, you can find it at Lumina Physical Therapy and Wellness. That's www.luminaptwellness.com. If you're interested in learning more about how to breathe properly, how to activate your core, and how to get into exercise, you can check out the Better with Age program. That's www.betterwithage.online. And right now, if you go to the website, you can sign up for a free breathing course. So all the things that Ann was talking about, as far as being able to see your abdomen move using your diaphragm properly, relaxing through the pelvic floor, and learning how the game changes a little bit when your core is activated, that's all covered in that free video series. So that's at www.betterwithage.online. Hope you enjoyed our talk. Have a great rest of your day. For the Better with Age team, this is Galen signing off.